Welcome back, everyone, to the Deep Dive. Today we are tackling something really important, and it's Autism Spectrum Disorder.
ASD.
Yeah, ASD. And I think this is especially important, for parents and educators out there.
Oh, absolutely.
It's something, getting this right can make a world of difference.
100%.
So we're using this really insightful article from bechange, this organization. And they do a lot to support people with autism.
Yeah, they're great.
And one of the first things to remember right off the bat is that autism is a spectrum.
Yeah.
It's not one size fits all. So we need to think individually, right?
Exactly. And, the spectrum piece is so key because as, ABA therapists, that is like what we do. Each person has, strengths and challenges and unique ways that they learn. And so we really want to approach everything from that perspective.
So let's unpack autism itself then. I mean, what causes it?
Right.
Is it like one gene and boom, autism? Or is it more complicated?
It's way more complicated, thankfully, because it gives us, areas to really try and understand it better.
Mm-hmm.
Think of it like a puzzle, like you said, but a puzzle where both your genes and the environment kind of fit together.
Okay.
So genes definitely play a role.
Okay.
Family studies often show that, but things in the environment can kind of, push things one way or another. For example, like if parents are older when they have a kid, or if there are certain things that the mom is exposed to during pregnancy, these things can increase the chances a bit.
So it's not just nature or nurture, it's both.
It's both, yeah. It's both working together.
Interesting. And, since you mentioned the environment, that just makes me think of all the myths out there, surrounding autism.
Oh my gosh. Yes. So many myths.
And I know you as an ABA therapist, you must hear this all the time, right? What's one of the biggest myths that you have to bust?
Oh, definitely the vaccines one. That is the one that we fight against the most.
The idea that vaccines cause autism.
Yes. I just want to be super, super clear that, the science has debunked this. Numerous studies have shown that it's just not true.
Right. It's so important to stick with, actual science.
Yes.
Reliable sources of information.
Evidence-based.
Okay, so let's move on then to how do we actually spot the signs then?
Right.
If a parent is listening to this, what should they be looking out for? Because the article did a really good job of breaking it down by age group. So let's start with the littlest ones, babies and toddlers. What are some of the early signs?
Yeah. So with babies and toddlers, things that you're looking for are less eye contact than you would typically see in children their age. Maybe they don't respond to their name when called. Their speech and language are a little bit delayed. Sometimes you see repetitive movements like flapping their hands or lining up toys over and over again. One that's especially concerning is regression.
Regression.
Imagine a child who knew their name and then all of a sudden they stop responding.
Oh, wow.
Yeah. And, any of these things means talk to your pediatrician as soon as possible, because early screening is really crucial.
Early intervention.
Absolutely.
Okay, so we've talked about babies and toddlers.
Mm-hmm.
What about as kids get a little bit older, how do the signs change?
So as they get older, these social differences become a little bit more noticeable.
Okay.
So you might see that it's harder for them to, make friends. They might really need routines to feel okay. Everyday things might bother them more than other kids their age. Things like loud noises or, just different things in their environment. Repetitive speech is another one.
Repetitive speech?
Yeah. So talking about the same topic nonstop or getting fixated on this specific interest. I had a child once who, oh my gosh, he could talk about trains for hours. And it was so hard to, shift his focus. Anything else was just not interesting.
So basically we're looking at how they interact socially,
right,
their communication style,
yep,
and how they kind of react to the world around them.
Exactly.
And then all of this is leading up to diagnosis,
Mm-hmm.
right? So what does that process look like?
Yeah, so it's multi-layered, which is a good thing. It starts with screenings. Pediatricians often use tools like the MChat. Have you heard of that?
Mm-hmm.
Yeah, so if that raises red flags, they'll refer you to specialists, psychologists, neurologists, and, ABA specialists.
So it's a real team effort.
Yes, Very much a team effort. We all work together. We conduct these very thorough assessments, observe the child's behavior, talk to parents about their development. We really want to get the whole picture of the child's strengths and needs. And, this is really important because it lays the foundation for an effective treatment plan. And that's where ABA comes in. It's one of the, if not the most evidence-based treatments that we have for autism.
So ABA stands for?
Applied Behavioral Analysis.
Okay, so can you unpack that for us a little bit?
Sure.
Because, I think a lot of people have heard of it,
Yeah.
but they might not really know what it is or what it entails.
So ABA is really rooted in the science of learning and behavior.
Okay.
So we're using it to, teach really important life skills.
But it's not about, forcing kids to act like normal.
No, not at all.
It's more about, helping them to thrive and live fulfilling lives.
Exactly. So sometimes that means working on, communication skills. Sometimes it's about things like, self-care or reducing behaviors that are causing difficulties or, even being harmful.
And I think it's really important to emphasize that, you're respecting the person's individuality. You're not trying to, cure them.
Exactly. We want to help them shine as their authentic selves.
So how does it actually work? How does ABA actually play out?
So at its core, ABA is really about using positive reinforcement.
Positive reinforcement.
Yeah. So we figure out, what motivates the individual, what makes them happy or excited, and we use those things to encourage positive changes in their behavior.
So instead of focusing on, punishing bad behavior, you're more focused on teaching and rewarding the positive behaviors.
Exactly. So we're building new skills. We're replacing those challenging behaviors with helpful alternatives.
Yeah.
An example of that would be let's say a child has tantrums because they can't communicate what they need. We would teach them, how to communicate effectively, maybe using, picture cards or sign language.
Oh, it's a great example.
And a key part of ABA, it's all data-driven.
Data-driven.
Yeah, so we track progress very carefully, and we adapt our strategies based on that data. So if something is working, great, we keep doing it. If it's not working, we change it. We're flexible, we adapt.
That makes a lot of sense. And, I've heard different terms like DTT and NET kind of thrown around in the ABA world.
Yeah.
What are those exactly?
So those are techniques that fall under the umbrella of ABA. So DTT is discrete trial training. That's a very structured way of teaching where we break down skills into teeny tiny steps.
So,
And we teach each step individually with really clear instructions. And we give immediate feedback. So think about teaching a child to tie their shoes. We would break it down into, holding the laces, making a loop.
Right.
And we would work on each of those steps, one at a time, rewarding success at each stage.
Oh, I see.
And then NET is natural environment training.
Okay.
That's all about teaching in, natural settings, like during playtime or mealtime. This helps the individual apply what they've learned to real life.
So instead of learning colors with flashcards at a desk, you might use colorful blocks during play.
Exactly. It's about, like you said, bridging that gap between learning and real life situations. And another really powerful tool that we use is called functional behavior assessment, or FBA for short.
Okay, what's an FBA? Is that a test?
It's more like detective work.
Detective work.
We use it to understand why a challenging behavior is happening.
Okay.
So what is the function of that behavior?
Oh, interesting.
So we observe carefully, we figure out what triggers it, and then, like a good detective, we come up with strategies to address the root cause.
So you're not just reacting to the behavior, you're actually trying to figure out why it's happening and then prevent it in the future.
Exactly. Proactive. An example, I had a child who he would have meltdowns every time it was time to transition from one activity to the next. And through the FBA, we figured out that it was anxiety about the unknown that was causing these meltdowns.
That makes sense.
So what we did was we created a visual schedule with pictures to help him kind of anticipate what was coming next. And it made a world of difference. He could see, oh, okay, first we're going to do this and then we're going to do that. And it really helped to reduce that anxiety and those meltdowns.
I love that example. It just shows, how individualized this approach is. And it's not just a cookie cutter approach.
Mm-hmm.
You're really tailoring it to each kid.
To each individual. We meet them where they are. We use the techniques and the strategies that best suit their needs, their learning styles.
So this is all super enlightening. I feel like I'm already getting a much deeper understanding of how powerful this approach can be.
It is powerful, but it's important to remember that we can't do it alone. Collaboration is key.
Elaboration.
Yes. So working with the child's family,
Okay.
educators, teachers, that's super important. We're all on the same team. We're all working together to create a consistent and supportive environment for that child.
So it's not just about like those one-on-one ABA sessions. It's more about equipping everyone in the child's life to be able to support them.
Exactly. And that's a great segue to the next point, which is, AB is the core, but what other therapies can, really support this process?
Yeah. Because it sounds like it really is a team effort. So who else is usually involved?
So speech and language therapy is often essential, especially for those who are, struggling with verbal communication. And this can involve everything from traditional speech therapy to learning sign language or using AAC devices.
AAC devices, what are those?
Yeah, so those are augmentative and alternative communication devices. Think high-tech communication tools. They can be as simple as picture cards or as sophisticated as tablets that allow individuals to communicate using pictures or symbols or even pre-recorded phrases. I worked with a little boy once. He was nonverbal, and with the AAC device, he was finally able to tell us what he wanted, what he liked. He could even tell jokes.
Wow.
Yeah, it was life-changing for him.
It's amazing.
And then, we have occupational therapy, which is all about addressing sensory processing challenges, as well as fine motor skills. So many individuals with autism have trouble, processing sensory information. Things like loud noises or certain textures can be really overwhelming.
Yeah, I remember working with a student once who could not handle the sound of the school bell.
Right.
It was physically painful.
Absolutely. And it's more common than you might think. So occupational therapists help, individuals manage those sensory inputs and participate more fully in daily life.
So it's about helping them navigate the world, more comfortably.
Exactly. They might introduce things like weighted blankets for calming or noise canceling headphones. They also work on fine motor skills like writing or buttoning clothes or using utensils.
That's fantastic. And what about the medical side of things?
Yeah, so we can't forget about medical and pharmacological interventions. While there's no medication to cure autism, there are some medications that can help manage co-occurring conditions like anxiety, ADHD, or, even sleep issues.
Sure.
And, these decisions are always made very carefully in consultation with doctors, as part of that overall treatment plan.
It really sounds like a true team approach.
Oh, it is. It is a true team approach. And, one thing I can't stress enough is the importance of early intervention. I know you mentioned it earlier, but I really want to drive that point home.
Why is it so crucial?
Study after study has shown that early intervention leads to much better outcomes for individuals with autism. The earlier we start, the better their chances of developing, crucial skills in communication, social interaction, adapting to their environment. It's all about harnessing the brain's amazing plasticity during those early years.
So it's like capitalizing on that window of opportunity when the brain is just so receptive to change.
Exactly. And, there are specialized programs that are designed for early intervention. Like one example is the Early Start Denver model. Have you heard of that one?
Right.
Yeah, so it uses ABA techniques.
Yeah.
But in a very playful and engaging way to
Right.
teach young children, those really important foundational skills.
It's fascinating how much research is out there that just really shows how effective that early intervention can be.
It really is. And, even with the best support systems in place, it's important to acknowledge that living with autism or caring for someone with autism comes with unique challenges.
Absolutely. And I think we need to, talk about the emotional and mental toll that it can take, both on individuals with autism and also their families.
You're right. Many individuals with autism also experience things like anxiety and depression, and we need to address those needs as well.
What kind of support can help with those mental health challenges?
So, therapies like cognitive behavioral therapy or CBT, that can be really helpful for things like anxiety and depression. And within ABA therapy, we also focus on teaching self-regulation skills, coping mechanisms to help manage stress, difficult emotions.
So it's not just about managing outward behaviors. It's about giving them the tools to navigate those inevitable ups and downs of life.
Exactly. It's about empowering them. And let's not forget about the caregivers.
The caregivers.
Yes, they need support too. Caring for someone with autism can be incredibly demanding.
Oh, yeah.
And so, access to things like support groups, respite care, those things are essential to prevent burnout and keep families strong.
It's like that saying, you've got to put your own oxygen mask on first
Yes.
before you can help others.
Absolutely. It takes a village, and a strong support network is key for everyone involved. And I think that's something we'll definitely want to explore more in the next part of our deep dive. What does a supportive and inclusive world for individuals with autism really look like?
That's a great question. And I think that's a perfect place to kind of pause for now, and then we'll pick up that conversation in part 2.
Sounds good. So, one thing that really struck me in the bechange article was how they tackle the misconceptions about ABA therapy.
Oh, yeah. I noticed that too.
Head on,
You're right. There has been some controversy surrounding it.
There has, and I'm glad they're addressing it because, as ABA therapists, it's something we encounter a lot. So, what are some of those common criticisms you've heard, and how do you typically respond to them?
Yeah, I'm curious about that too.
Well, one of the most frequent ones is that ABA is all about forcing kids with autism to act like, neurotypical children, basically trying to cure them.
Okay.
Which is, a fundamental misunderstanding of what ethical modern ABA is all about.
Right. So it's not about like erasing their individuality or trying to like make them fit into some, predetermined mold.
No, not at all. The goal of ABA is really to help individuals with autism learn skills and behaviors that will, enrich their lives, help them to thrive.
Okay.
This might involve improving communication, learning self-care skills, or reducing behaviors that could be harmful or, prevent them from learning, connecting with others. But it's always done with the utmost respect for the individual's autonomy, their dignity.
So the focus is really on empowering them, not changing who they are at their core.
Exactly. We want to help them shine as their authentic selves. Another one we hear a lot is that ABA is too rigid, too structured, like there's no room for creativity or flexibility.
Mm-hmm. Yeah. Mm-hmm. I could see where that perception might come from, especially with techniques like DTT,
Right.
which we talked about, which can seem very structured.
Yes. It's true that, some ABA techniques, particularly in the early stages, do involve a more structured approach.
Okay.
But ABA is incredibly dynamic and adaptable.
Okay.
So as the individual progresses, we gradually reduce that structure. We incorporate more natural teaching methods like NET, which we talked about. And even within the structure, there's plenty of room for creativity and individualization. It's about finding, the right balance.
That sweet spot between structure and flexibility, tailored to each individual.
Exactly. And at the end of the day, the goal is to help the individual become as independent as possible. We're equipping them with the skills they need to, competently navigate the world, make choices about their own lives. And we can't forget, about all the amazing people who support individuals with autism every day, right? Parents, caregivers, educators, they play such a crucial role.
Absolutely. They're really the backbone of that support system, providing love, encouragement, consistency. But it can be pretty demanding, right?
It can.
I mean, what are some of the biggest challenges that you see caregivers and educators facing?
One of the toughest things, I think, is managing challenging behaviors. Meltdowns, tantrums, aggression. These can be incredibly stressful and difficult to handle, especially when you don't really understand what's triggering them.
Right.
And that's where, a deep understanding of ABA principles can really come in handy.
Makes sense.
It really is essential. When you understand the function of a behavior, you can start to develop strategies to either prevent it or, respond more effectively. I was working with a family, and their son would have a meltdown every time they went grocery shopping.
Oh, wow.
It was like every single time. And through the FBA, we figured out that it was sensory overload. The bright lights, the crowds, all the noises, that was triggering him.
That makes sense.
It does. So what we did is we created a visual schedule with pictures of each step. We brought noise-canceling headphones for him. And we even practiced going to the store during less busy times.
So you kind of helped him to cope with those sensory challenges while also teaching him how to navigate that environment.
Exactly.
Collectively.
It made a huge difference. And this highlights why collaboration is so important.
Yep.
ABA therapists, caregivers, educators, all working together to create this consistent approach.
Okay.
That benefits the child across all environments.
So what are some other practical tips that you would give to caregivers and educators to kind of help them create a more supportive environment?
I always recommend establishing clear routines and predictable schedules. So many individuals with autism thrive on that structure, knowing what to expect, having a visual schedule with pictures, that outlines the day's activities, that can make a world of difference in reducing anxiety,
Okay.
making those transitions smoother.
So it's about creating a sense of predictability, kind of control
Yes.
in a world that can otherwise feel chaotic.
Absolutely. Visual supports in general are incredibly powerful, especially, for individuals who are struggling with verbal communication. Picture cards, social stories, visual timers, these can help with understanding expectations, communicating needs, even learning new skills.
It's amazing how, like, a simple visual aid can make such a huge difference.
It really can. And of course, positive reinforcement is always key. Focusing on rewarding those desired behaviors is so much more effective than, just focusing on punishing undesirable ones.
Right.
This could be, tangible rewards like stickers or small toys. But honestly, often a simple verbal praise, a high five, or even just access to a favorite activity, that can be incredibly motivating.
So it's about tapping into what makes each individual tick.
Exactly. You got it. And I also can't stress enough, patience and empathy. It's so important to remember that individuals with autism aren't, intentionally being difficult or defiant.
Right.
They experience and process the world differently, and we need to meet them with understanding and compassion.
So much of it just comes down to, like, shifting our perspective.
It really does. It's about appreciating their unique strength.
Right.
Celebrating their successes, no matter how small they may seem. And speaking of strengths, we've talked a lot about the challenges, but I'd love to hear more about the amazing abilities that many individuals with autism possess.
Right. Let's shift the focus to the positive, because
Yeah.
I think it is so important to, recognize and celebrate those strengths. Like, what are some of those?
Many individuals with autism have this incredible attention to detail,
Okay.
amazing visual, spatial skills, and remarkable abilities in, areas like math or music or art.
I've heard some individuals with autism, they have, like, almost savant-like abilities
It's true, some do.
in certain areas.
Extraordinary talents in memory, calculation, music, and even beyond, these exceptional abilities, many possess qualities that are so valuable.
Okay.
Honesty, loyalty, a strong sense of justice.
It's about recognizing that neurodiversity is a strength, not a deficit.
Yes. Individuals with autism enrich our world in countless ways, and we need to create a society that values and embraces those unique perspectives and talents.
Absolutely. This has been such an insightful conversation. I feel like I'm gaining a much deeper understanding of the complexities of autism and, the importance of that personalized, compassionate approach.
I'm so glad to hear that. Knowledge is power. And the more we understand about autism, the better equipped we are to support individuals and their families.
And there's always more to learn, too. Like, research is constantly evolving, shedding new light on this complex condition.
It is.
So what are some of, like, the most exciting areas of research happening right now in the field of autism?
So many. One that I find really fascinating is the study of the gut-brain connection
Oh, wow.
and its possible role in autism.
Interesting.
Some research is suggesting a link between gut bacteria and certain behaviors, neurological symptoms associated with autism.
So we might be able to, like, influence brain function and behavior through things like diet.
It's still early. The research is promising, definitely worth watching. And another exciting area is the development of new technologies to support individuals with autism. Virtual reality, for example. It's being used to create social skills training programs that are super engaging and interactive.
I can see how VR would be helpful in that way, like to create a safe, controlled environment
Right.
to, like, practice social interactions.
Yeah.
Like a dress rehearsal for real life.
Exactly. And then there are wearable sensors that can track things like, heart rate and skin conductance. And this data can help us understand how individuals with autism are responding to, sensory input, which can then lead to better strategies for managing sensory overload. Imagine, like, a smartwatch that alerts you when your sensory input is getting too high, and it suggests a calming strategy.
Wow, it seems like technology is opening up a whole new world of possibilities.
Right. It is. And it's fantastic to see, individuals with autism and their families playing a more active role in shaping those research priorities. They're advocating for research that focuses on, real world challenges and improving quality of life.
Having that lived experience at the forefront is just so essential.
I completely agree. It's about empowerment. And that's a theme that runs through everything we've talked about today. Autism is not something to be feared or ashamed of.
Right.
It's a different way of being, a different way of experiencing the world. And with the right support, individuals with autism can lead, meaningful and fulfilling lives.
Such a powerful message. And I think that's a great transition to the final part of our deep dive, where we'll explore, what a supportive and inclusive world for individuals with autism looks like. The last part, you touched on something that I thought was really important, and that is this idea of building a world where neurodiversity is truly celebrated and embraced. But what does that actually look like in practice?
Yeah, that's the big question, right? I think, it starts with awareness and education, like, what we're doing right now.
Right.
But it goes beyond just, knowing about autism. It's about challenging our own assumptions, recognizing that there are many ways to be normal, and valuing the unique contributions of, every individual.
So it's about like shifting our perspective from fixing those differences to embracing them.
Exactly. And that shift needs to happen, on multiple levels in our communities, in our schools, in our workplaces. We need to create environments that are truly inclusive and accessible for, individuals with autism.
What would those environments look like? Like, can you give us some concrete examples?
Yeah, absolutely. So in schools, it might mean providing sensory-friendly spaces, visual supports and flexible learning environments to accommodate different learning styles. I worked with one school that created a quiet room with dim lighting and like soft textures where students could go, to decompress when they felt overwhelmed. And it made a huge difference in, their ability to focus and learn. What about workplaces?
Yeah, what about workplaces? How can we make those more autism friendly?
Well, it might involve things like providing clear and concise instructions, breaking down tasks into smaller steps, offering, flexible work arrangements. One company I consulted with, they implemented a mentorship program that paired neurotypical employees with autistic employees to kind of help them navigate the workplace culture. And it really fostered understanding and, created a more welcoming environment for everyone.
It's inspiring to hear these like real world examples of inclusion, actually happening.
It is, and it's happening more and more, which is very encouraging. And, even on an individual level, we can all do our part by, being patient, being understanding, and being willing to communicate in ways that work for everyone. Sometimes it's as simple as, just asking, how can I best support you?
Such a simple question, but so powerful.
Yeah. Right. It really shows respect, a willingness to learn. And remember, even small gestures of kindness and acceptance can have a profound impact.
This deep dive has been so eye-opening for me. I feel like I've learned so much, not just about autism, but also, about the power of human connection and the importance of creating a world that embraces neurodiversity. Any final thoughts before we wrap up?
I think you said it beautifully. Knowledge is the first step, and from there, it's about action. Let's all commit to creating a world where every individual, regardless of their neurology, feels valued, respected, and empowered to reach their full potential.
Absolutely. And to our listeners out there, we encourage you to continue learning, exploring, and advocating for a more inclusive world. We've only just scratched the surface today, but there are so many incredible resources available. Organizations like bechange that are doing amazing work, providing support, education, and a sense of community for individuals with autism and their families.
I second that. Bechange is fantastic. And, remember, you don't have to be an expert to make a difference. A little bit of understanding and compassion can go a long way.
So well said. Thank you so much for sharing your expertise and your passion with us today. It's been an absolute pleasure having you on The Deep Dive.
The pleasure was all mine. Thanks for having me.
And to our listeners, thank you for joining us on The Deep Dive. We'll see you next time for another fascinating deep dive.